We're going to be looking at factual and legal causation. Those two things, as I hope you know, are different. We'll be looking at how they're different and how they're proved in different ways. We'll be talking, of course, about but-for causation, the most clear and obvious way of proving causation. That comes on to proving harm. How do we prove harm through but-for causation? How do we prove harm in cancer cases? They're often very difficult in a clinical negligence context. We're going to talk about the benevolence principle, which is an interesting area to talk about. We'll be touching upon that. And of course, we'll be talking about material contribution to harm. And because medical science often doesn't carry out studies that look at two groups of patients, one of whom receive negligent care and one of whom receive non-negligent care, it's often very difficult to work out what the outcomes would have been. And so your medical experts will often refer to scientific literature, and they will often refer to statistics as they appear within scientific literature. Now, what do we do then when we're looking at legal causation and we're comparing that with scientific certainty? Because, of course, there's a difference between the way things are reported in medical studies and the test that we apply as lawyers. Because as lawyers, we are applying a but-for causation test. In medical literature, they're talking about a high degree of certainty, a scientific certainty. Now, in some cases, you're not looking at past events. In other words, you're not looking at a claimant who's developed a vascular necrosis, as in Hodgson, and asking yourself, would they have had a better outcome on balance of probabilities? You're looking at future events, and you're trying to work out, has the claimant lost a chance of a cure? And that's usually the case in cancer claims. You're looking at the question of whether this claimant now has lost the chance of having a cure. Now, if you want to prove that the claimant has suffered a loss by not being cured, you have to prove that their prospects of cure have fallen from above 50% to below 50%.